Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
On today's episode, we're going to talk about anti-inflammatories and are all anti-inflammatories created equal?
I get this question a lot because there are dozens of different types of anti-inflammatories, and
Yes.
people have tried different ones and they want to know, is one the same as the others?
Yeah, and that ranges from over-the-counter to prescriptions, so we're going to kind of try to break all that down for you. And it can be overwhelming. You get in that aisle, there's 500 different boxes, they all have flashy advertising. We just want to know, and patients want to know, what's going to be best for them. So where do we start, Paul?
Well, I think the first one, probably the classic anti-inflammatory, is ASA.
Yes.
Just ASA. Aspirin,
Yep.
and a classic, take 2 aspirin and call me in the morning.
Yes.
It goes back 100 years. So that's probably your most basic type of anti-inflammatory. I don't think a lot of people use that now for pain control. It's more used for blood clot prevention. And
I would agree. Occasionally I have an older person who says, oh yeah, I'd still do it because of those ads. It was effective.
Yeah, okay. So I'd say that's the first one that you've probably all heard of, and we can all base everything off sort of ASA.
Totally agree. And then I would say the next one that's probably become more common is ibuprofen.
Okay.
It's a trade name Advil. A lot of people recognize this. Certainly a lot of people take it. You can just go to the pharmacy, grab a box, and head home.
Yeah, no need a prescription for it. Advil. So, and it's very similar to
Yes.
ASA. It's a very broad type of anti-inflammatory.
And what's different about anti-inflammatories to the layperson is kind of where it interacts along the pathway of inflammation control. So for scientists, it's really important. For a patient, it doesn't really matter until you get into the side effects. So before we get to that, Paul, how does it work for anti-inflammatories as far as how much relief they're going to provide for you? Are they different?
Different, well, I think different. There are some anti-inflammatories that are stronger and prescription type. However, I think it's very individual. You might have one individual that says, yeah, this anti-inflammatory worked great for me, that anti-inflammatory didn't work for me.
Yep.
That is going to be one of the main differences, and the other main difference is probably going to be on the side effect profile.
So sticking with the effectiveness, totally agree. I have some people who swear by one and swear against another. And certainly the science shows that the benefit or the pain relief from over-the-counter anti-inflammatories is about the same across the different brands, but individually certainly there are variations that can't be totally explained.
Okay, so we've got ASA, ibuprofen.
Yep.
The next one I would say in that line would be naproxen. Probably.
Yes, I would agree.
That one, around in Canada, actually, that used to be a prescription, but now it's there's formulations of it that are over-the-counter. So
Yes.
Over-the-counter just means you don't need a prescription for it. You can walk in and buy it yourself.
Right. And so then after naproxen, then becomes the prescription ones, and probably the biggest one is the class of COX-2 inhibitors, or COX-2. It stands for cyclooxygenase. It's just a scientific term for where along that path it stops with the working of that mechanism.
Yeah, and the way I think of it is it's a little bit more focused for inflammation in joints, like in the knee or the hip or something like that, or shoulder or elbow. It's a little more focused. It has less of a broad anti-inflammatory effect.
Yep.
So it doesn't affect the same sort of pathways or different pathways in the gut
Yes.
as much.
And that's probably the primary difference, right? Is that it's safer for risk of things like gastritis and ulcers. And then I guess the last class would be the steroid or the steroidal anti-inflammatories,
Right.
things like prednisone, heavy-duty medications that definitely require prescriptions and will also require a long discussion with your doctor as far as the risks and
And
benefits.
another video in its entirety.
Totally
So
agree.
these ones, not the steroid ones, are non-steroidals, NSAIDs, NSAID, non-steroidal anti-inflammatory.
So when it comes to this stuff, Paul, and we talk about the risks, that's primarily how we decide who's going to get them. What do we worry about? What are like the top 3 or 4 or 5 things that we worry about?
Sure. So every treatment has a risk of a complication. Whether
Agree.
you're talking about taking a pill or having surgery or anything you do, any treatment has a risk of complication or side effect. And so for NSAIDs, these pills that you take, there are the risks. I think of it in terms of, well, how does your body excrete it? And your body excretes it using your kidneys.
Right.
So it's excreted by the kidneys, so it can damage your kidneys.
Right. So anyone that has previous kidney dysfunction, so classically diabetics, people with uncontrolled high blood pressure, or some type of genetic kidney disorder have to take this either under the guidance of their physician, like the family doctor or the nephrologist, or maybe not be able to take it at all.
Right, and how are you going to know something's going on with your kidneys? Well, your kidneys regulate your blood pressure.
Yep.
So hypertension, you could start developing hypertension. If you have hypertension, it might be an indication of kidney disease. You should probably really think twice before taking the anti-inflammatory and talk to your doc about it.
For sure. Number 2 for me would be certainly the stomach. So all anti-inflammatories carry a risk of gastritis or ulcers. So if you have a history of significant reflux disease, a hiatus hernia, or a previous ulcer, you either are becoming a candidate where you cannot take them, or you definitely have to take it under the supervision of your family doctor or a specialist. And generally speaking, if you're taking over-the-counter anti-inflammatories for more than 7 days, you probably should discuss it with your physician.
Yeah, I think that's a good point. Definitely you want to talk about it. If you're taking it more than a week, talk to your physician. I know a lot of people out there taking a lot of anti-inflammatories here and there, but if you're taking it like regularly,
yes,
for a week, every day, maybe check with your family doctor.
So we got kidney, we got stomach.
Heart disease.
Heart disease. Okay, what about heart disease?
Well, there is an increased risk of heart disease or of a heart attack or some sort of cardiac event associated with some of the anti-inflammatories. And there used to be one on the market. Remember Biox?
A lot of people very fondly remember Biox because it worked well for pain and stuff.
And I had samples of Biox. I'd give it to everybody,
like
trick or treating. All my patients. It worked so well.
Yes.
But then there were some studies that came out that showed it had an associated cardiac risk, and that went off the market.
Yeah, and they couldn't totally show that it was because of the Biox, but there was enough concern about it that it was withdrawn, and then they did some more research and it never came back.
Yeah.
So yeah, definitely heart disease, and I think right together with that would be stroke. So it seems to be the common mechanism of heart disease and stroke are potentially affected by anti-inflammatories. So if you have any of those background problems, definitely discuss with your family doctor.
And you may be sitting there going, well, that's weird because my family doctor told me to take a baby aspirin once a day.
Yeah.
It is weird. There are, a slow dose aspirin is used to prevent blood clots, and to prevent platelet formation in your arteries and things like that. So that is a contraindication. We recognize that, but we're talking about higher dose anti-inflammatories for treatment, not talking about the low dose anti-inflammatories that you might have been prescribed by your family doctor or cardiologist. However, it's not my area of specialty, but I have seen some of the evidence to that be questioned.
The aspirin.
Yeah.
Very recently, even more so. I totally agree. But a very nice segue, because after heart disease and stroke, I would say bleeding. So we talk about how aspirin and anti-inflammatories potentially have an effect on your ability to make blood clots, either through the platelet system or other systems. So if you have a known bleeding disorder, or if you are taking a prescription anticoagulant, like so many people are for their hearts or for stroke disease, you definitely have to take that under the guidance of a family doctor.
And that's a big one for us surgeons, right? Because we make an incision, we make people bleed, and we hope they stop bleeding eventually. So
and we don't want them to stop bleeding too much to get a clot after surgery, so we're never really happy.
That's a balance.
Bleeding, not bleeding.
It's like life.
Right. So blood clots or bleeding, definitely have to see a specialist or talk to your family doctor about it.
You might even notice that you bruise easily if you're taking anti-inflammatories for a long time. You might say, oh, I notice I bruise easily. That's because of the platelet inhibition that's going on. And you're seeing the blood and the subcutaneous tissues.
I would say those are my top ones. Are there any ones hiding in the back? Oh, I'd say the last one I'd say is a formal identified allergy.
Allergy.
To aspirin or anti-inflammatories. So
you always. That's why we always ask you: are you allergic to a medication? That's one of the questions that your almost all doctors ask their patients: do you have any allergies? Because we don't want to give you something you're allergic to.
Yes.
Please, when you're asked, do you have any allergies? Don't give an answer that's not an allergy. For example, do you have any allergies? Yes, I'm allergic to sleeping pills. They make me so drowsy.
That's not an allergy. That is actually the goal of the sleeping pill.
I'm allergic to narcotics because they get rid of my pain.
Yeah. Or they give you a sore stomach. So sometimes people describe side effects as allergies, and that's actually a whole another video about the allergies.
When we ask you about allergies, it's because we're worried about these, like a rash or something that's going to make your throat close and make you stop breathing.
Okay, so we've summarized the different kinds of anti-inflammatories, what their side effects are, who should take them, who shouldn't take them. What do you think, Paul? That pretty much covers it?
That's it.
Okay, so if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.
I gotta take an aspirin, I got a headache.